Hello, friends. This is Justin Jones with the Lake Whitney Chamber of Commerce podcast. I'm joined with you today with fellow director Adam Bain. We also have Colt Hatcher here. He is a director, but he's joining us as a guest today. We have two other guests today. If you'd like to go ahead and introduce yourselves, we'll go with seniority on this.
Well, that would be me. This is Clay Pickering. I'm one of the family medicine doctors here in the Whitney area, and I've been here for roughly 20 years now. Background is, well, I have a beautiful wife, two great kids. We have been living in the Whitney area. I've lived in Texas most of my life, and grew up as a military brat, and I'm still a brat. But that's okay. But very much enjoying straight ahead family medicine, enjoying the relationships that we have out here in the lake, beautiful Lake Whitney. How about you, Courtney?
I'm Courtney Mayfield. I'm an LPC, which is a licensed professional counselor. I've been with Goodall Witcher as an employee just for a few years now. My husband and I moved to this area about 6 years ago. He grew up in the Waco area. So we basically moved home for him about 6 years ago. What else am I supposed to say about me?
Anything you want to say?
How long have you been in LPC, Courtney?
Oh, I've been in LPC a little over 10 years. And I love what I do. I like helping people. That's how I got into this job. I wanted to serve others. That's one of the main things that got me into wanting to be a counselor. I worked as a child protective services investigator first and got my degree at night becoming a counselor. So that's kind of how I got into this gig.
Very cool.
Really, really well. She sees a lot of patients. She's expanded now in 2 different counties. She's very modest, apparently, but gets really good reviews around the area, and has filled up fast once she's spread into the Whitney area.
And of course, I have the privilege of working alongside both of them at Goodall Witcher, and they will tell you that I'm the boss, but that is far from the truth. These two make things function and flow every single day, and they take excellent care of all of our patients. So
is boss right, or is it more like taskmaster?
There's all kinds of names that everybody could call me, so just take your pick.
So, Dr. Pickering, just for a little bit more background, kind of curious, what got you into your field? What really pulled you into the profession you're in?
Well, it's kind of interesting. It's long and a little bit windy, but try and stay with me on it. I started off in music. Can you see the relationship?
No.
I know. So I started off in music and came from a very musical family. Everybody plays instruments and so forth. Growing up in the military, but thought I was going to go and be a musician, and went to the university on scholarships, and about 3.5 years into it, began to realize, you know what, this is not my thing. So switched horses and went into science and research, more into pharmacology, study of drugs and their effects on people. Did some science and then began to realize that I really needed to not be so much in front of a test tube and experiments, which I really enjoy, but also need to be exposed with people. So began to look around and decided, hey, medicine looks like a great way to go. So I began to blend those two ideas together, being a little more social and also my love of sciences. And then I get to do a little music on my side. So that's how I got into medicine. Research.
Very cool. Very cool. Courtney, so you mentioned that you like helping people. That's kind of what brought you to your field. but as you know, I mean, there's a wide range of ways you can help people. So what really honed you in on what you're doing?
Well, I think so. To make a long story longer, when I was in college, I figured out kind of what I wanted to do my senior year, and I was a history major. So I have a history and political science degree for my bachelor's degree.
Wow.
And I was going to a small church and we had kind of put together a little social service organization, like hooking people up with, it was really kind of a social work organization, hooking people up with help. I went to school down in Corpus Christi, just helping people with bills, with food, things like that in my church. And I would make the phone calls and, just kind of put people with other people in the area. And that just seemed kind of like the right way to do it. I was a Christian. I became a Christian in college, and, serving other people, going out and doing for others was what I wanted to do. Now, my sister that I lived with at the time was a sociology major. So she's the reason I went to work for Child Protective Services. And while I was at Child Protective Services, I worked closely with the counselors there. After talking to them and getting to know them a little bit is really I was like, hey, this is the field that I want to go into. This is what I really feel like could help change the direction for people. So that's really kind of what got me here to where I am today.
Mm-hmm. Okay. What about you, Colt?
Kind of the same story. I think everybody gets into healthcare for one reason in particular, and mainly that is to have the ability to help people. I started off my career thinking that I wanted to go to med school. Spent some time with a family friend up in Ohio and shifted directions after spending that summer with her. Realizing that I can have the same effect on people from the business standpoint as I could the medicine and the science standpoint. I actually have a biology degree and a chemistry degree, but I had to work really hard to be smart at that. And the business side of things came a lot more natural to me. So once I realized that I could serve my same mission from the business standpoint as I could physically laying hands on people, that kind of made my decision pretty easy. And then it was figuring out the trick from there. I mentioned on the first podcast, plug for the Lake Whitney Area Chamber podcast to go listen to the first one. Kind of my career path and how I landed to where I am today. But, I think between the three of us, we've had multiple conversations through the course of all of our tenure at Goodall Witcher. And it's kind of the same story. Our mission and our guiding principle is to help people. We just kind of all do it different, and we're in the same industry, and it just looks a little different. But our ultimate passion for everything that we do are people. Bottom line.
Yeah. So it definitely sounds as though everyone's heart is in the right place. They went into their fields for the right reason. And so for those of you listening, obviously the theme of this interview today is the medical profession. And given the state of things as they are right now, obviously we can't have three medical professionals on an interview and not mention the pandemic, which obviously is a very big deal with many people. So I would just like to ask each of you, really, how has this affected what you're doing on a day-to-day basis? I'm sure. I don't know. I mean, I can't even imagine how drastically things, coming from education, I know how drastically that has been impacted. And so I can't even imagine someone that is directly dealing with patients every day, how that must be affecting y'all.
So I think I'll go first because, the nature of my job, I view things from a 30,000 foot level. So we can kind of stagger that down from 30,000 feet, and these two work front lines hand in hand with patients every day. I remember February 27th like it was yesterday. There's a reason why I remember that date so well. It's kind of the day that COVID hit for us in Bosque County and Goodall Witcher. Mm-hmm. Kind of the first real press release that happened. And just like anything else, it's like, okay, well, the media's blowing this out of proportion. It's not that big a deal. It'll be here today, gone tomorrow, no problem.
Yeah.
And then as the day progressed, we're coming up now on September 11th, pretty close. It's kind of the same deal. As the day progressed, you get more and more details of how things are rolling out and what's actually happening and how serious things are.
Mhm.
So very quickly over the course of the next several days from that date, we decided that we needed to get some policy enacted pretty quickly. And it was going to impact everything that we did from an operational standpoint with Goodall Witcher. So our admin team essentially locked ourselves in a room and said, okay, here's the deal. Like, we've got to write some policy around how this is going to affect us and what our business operations are going to look like moving forward from all standpoints, from a physician level, from an LPC level, from a nursing level, from the patient's perspective of how we're dealing with things. So we kind of, like I said, spent the next several days locked in a room together, arguing about what the best policy is and what the best practices are, and drawing physician input in and provider input and clinical input, from all viewpoints, and kind of ultimately landed to where we are now. I will say there's been a couple of things that I've been thoroughly impressed with, and that's the communities we serve. We immediately had both Ace Hardware in Whitney and in Clifton. They stepped up and they gave us some donations to give us the ability to be able to treat patients better. Honestly, from day one, our biggest concern was PPE. That's kind of before COVID, I could have walked down the street and said, hey, tell me about PPE. And nobody would have had any idea what we were talking about unless they were in the medical field.
Okay.
Now that's kind of common nomenclature where people understand when you say PPE, everybody knows what we're talking about. We were drastically concerned about that. And we did the calculations of what we had on hand. If we were to have one COVID patient that we were going to have to deal with within those first couple of days, we would have been completely out of PPE for all staff, everybody included, clinic, hospital, everybody, in about 3 days.
Wow.
So that was an eye-opener for us of we've got to figure out how to manage that, as well as manage the patient population that potentially was going to influx from the COVID outbreak, as well as much information as we could possibly get to our clinicians to be able to treat those patients appropriately. One of the things that paradigm shifted drastically from a clinic practice standpoint that these two guys are ingrained in deeply was the shift to telemedicine. Prior to COVID, it was actually illegal for clinics of our type to provide telemedicine services. And then they released some waivers that gave us the ability to do that. And I'm kind of the most proud of being able to upstand a telemedicine program in 4 days. So we went from literally zero telemedicine to a full-blown telemedicine practice within 4 days.
Wow.
And that's an attribute to these guys and to the rest of the team. I was just kind of the facilitator in all of it, but it's absolutely amazing to see that transformation and to see how well our community is taken to telemedicine services. And I know Courtney is going to have a ton of input on that, because that's still to this day the vast majority of her patients she sees via telemedicine.
Oh, wow.
So that's kind of the 30,000 foot view, and I'm sure we'll get more ingrained into some of the operational things, but that was kind of from my perspective of how things flowed from day one to sort of where they are now. So
it's really interesting. You asked how things have changed since the day zero of COVID,
Mm-hmm.
and it's changed in so many different ways. We've just never ever seen anything even remotely like this, not just in the United States, but the whole world. Nobody has ever considered shutting down countries, shutting down states. Even the science behind it. We've never seen viruses that act like this. We know it's a SARS virus, and we know pretty generally how SARS viruses work. But even in the science community that we are, so proud of, how have things changed? Well, we were learning as we went. We've never been exposed to this kind of a pandemic. So, we've learned a lot about other viruses like the SARS virus. We know it's a SARS virus, but it doesn't behave exactly like a SARS virus. we're learning about things that we never thought about with other viruses. There are a couple of very insidious uh, behaviors that this virus seems to involve. One is this blood clotting disorder. We've never really seen that with this kind of virus. Another is this inflammatory cascade. So we're learning things here, even just in science, that we're learning on an exponential, just a day by day basis.
Mm-hmm.
So it's not just how things changed since COVID. It's not just science; it's also workflow, how we go about organizing our days and taking care of the needs that are out there with the patients. Like Colt said about using telehealth and telemedicine, really capitalizing on that. Been really proud of how the country, the government, and our community has come together and said, okay, we need to just scrap what wasn't working before, and let's just take care of people and get rid of all the bureaucratic rules and if you need to just talk with people on the phone or on a telehealth visit to get things done, that's our highest priority.
Mm-hmm.
So I've been pretty proud of that. Just looking at how things have changed in the environment, we're learning about, social distancing. It's actually a very good thing. Washing and so forth. I'll tell you, usually I get probably 1, sometimes 2 summer colds, almost like clockwork. It's just a virus that comes along, and I get them pretty much every year. Since I've been wearing a mask, I haven't had one. It's like, this is actually a pretty good idea. So there may be a lot of other changes that are coming along in the future, but one of the biggest things that I see in patients is not what I was expecting. I was thinking maybe I would see a lot more of a respiratory, pneumonias, and so forth. And yes, we do see COVID here in this county, but the biggest change has been probably anxiety, the worry, the fear, all the questions surrounding the what if. Those are huge among patients and among not just patients but ourselves.
Mm-hmm.
And so trying to partner with patients and advocate with them and our mental health professionals like Courtney, trying to figure out how do we all as a family go through this together. What are some good techniques? Do we just let ourselves be thrown to the wind of panic and anxiety and fear and unknowing? Or are there some ways that we can take control and work in a more healthy way to continue to get our jobs done in taking care of patients? So
I see.
A lot of things have changed, but for the good overall, I think.
Mm-hmm. Okay. Courtney, what are your thoughts?
I think what I saw when this first kind of hit was a lot of shock and denial by my patients about, we first started telehealth and told them, hey, you can't come in, you have to talk to me just like I'm talking to you over this video chat. And that was something that a lot of people were unwilling to do. Not everybody, but some people. So I think that they just couldn't believe it, and that was hard. And I'm sure that Dr. Pickering saw that as well. And so but I did see a transition. I did see that people did change, and they transitioned with it, and they figured it out, and they figured out that it wasn't so bad. And so, even though it has been really hard and it has been anxiety producing for sure, I have seen that. And we definitely want to talk more about that. I think that people have been able to transition into what we've been asking them to do in healthcare pretty well. What I've seen for the most part is that depression and anxiety have increased over the quarantine with every age, across all the ages, from kids to adults to the elderly. Kids during this time span that they weren't in school, lost their social skills. They really just lost their ability to talk to their friends and communicate with them, face to face, and really just kind of became hermits, if there's not a better term. They were stuck inside. They were stuck, just within their four walls and their family. And so that not only was that anxiety producing for them, but kids and teenagers already have like a little bit of some social anxiety already. And so I think that exacerbated that problem, as well as the patients that I already see who have depression and anxiety. That's what I was treating them for in the beginning. And then something like this hits, and then it makes those issues a little bit bigger for them. Yeah. So unfortunately, that is what we've seen. We've seen that impact those things and make it worse.
How do you feel as though you describe how it's impacted, the youth, but what about the adults? And not necessarily just the adults you're seeing, but just in general, how is this increasing their anxiety?
Well, and so what I was thinking about today when I was thinking about what we're going to talk about in this podcast was, it's not when we're talking about COVID and this disease or this, this virus, and we're talking about how it creates anxiety. I ask a lot of my patients up front, okay, are you afraid of getting sick? Are you afraid of this virus? Or that is true. There are a lot of people out there who have anxiety about what's going to happen to me if I get this, if I get sick. Am I going to be one of the ones that it impacts greatly, that puts them in the hospital? There's that fear out there. But I think for a lot more of the people that I've seen, it's more about how it impacts their daily lives and how it impacts them on a different level, not just being sick, but, the quarantine process and, what happens if my kid, comes in contact with somebody. It's what I want to call the domino effect. I've come in contact with somebody or I get it, and what happens after that? Mm-hmm. How do the dominoes fall from there? That's where I see that anxiety is heightened because of COVID. It's all the things that happen after. It's all the things that happen because of, not just the actual virus.
I see.
Does that make sense?
Yeah, absolutely. I was just curious because back in March, when all this was really hitting hard, it was a short period where I'm not really a very anxious person, right? And I noticed I was feeling I was feeling anxiety. And I was thinking to myself, what has really changed? And at that time, I had downloaded a news app to my phone, and it was sending me notifications, right? And at that time, that's all you're hearing is virus, virus, virus. And I was checking it because my phone's dinging, and so I was getting exposed to this stuff all the time. I deleted the app, and the anxiety went away. So I just didn't know. I didn't know, what other causes there might have been. I know in my case, it was just the constant exposure, overexposure to it, from a media standpoint.
No, you're completely right. That's another way that we get exposed. That's another way that we get anxiety, is the constant looking at the news, the constant seeing it on Facebook, or the updates and all of, people checking the numbers for the day. That can be anxiety producing too.
Yeah.
So, and this is going to give everybody anxiety at the beginning of my story, and then at the end it'll make you feel better. So, to divulge a little bit of personal information. So, I'm actually a statistic. I was a COVID positive case, which is extremely ironic, because I am the person that is walking around our clinic yelling at the two of them to put on their mask, and the person who is in charge of writing the policy around keeping everybody in our organization and our community safe. But so I caught it from my significant other. So she is a nurse, and she caught it from work. And we have 4 small kids at home, all under the age of 6. And so, of course, both company policy and the policy that I helped write says I need to stay home for 14 days. At that point in time, it was 14 days since the CDC recommendations have changed. And I will tell you,
It was the best vacation and blissful holiday ever. No, I'm sorry.
that was the biggest nightmare I've ever been involved in my life. You can imagine having 4 small kids trapped inside that couldn't go play with their friends for fear of exposure.
Mm-hmm.
We couldn't let them go outside. We were both still attempting to work from home, just like a lot of people are right now, you know, working on Zoom calls like we're doing. Having my 3-year-old daughter seriously for 8 hours of the day stand at our office door and just sit there and like stare at me. And like occasionally she would, you know, Dad, are you on the phone? It's like, no, what do you need? Daddy, I need a snack. And it's like, okay, well, now I've got to interrupt my work day and go, you know, just stuff that I'm used to doing for Dr. Pickering, getting him snacks and drinks that now I have to do for somebody. But, you know, with that being said, so my significant other has stage 4 cancer. She is the person who checks every box that there could be checked from to be the person that is critically ill. And for her, all she did was take a couple of naps during the day. For me, I never showed symptoms other than losing my sense of smell.
Mm-hmm.
So, you know, for some people, for me, from an administrative perspective, none of it makes sense. It may make more clinical sense to people, but, you know, it affects people different. And I think having the fear of how it's going to affect you is dumbfounded because we have people who deal with it every day, like Dr. Pickering, like Courtney, like our other medical professionals that are well trained enough to be able to handle, you know, anything that this throws at you. And even with the unknown, there are prescribed principles around the things that they do daily. So to put your anxiety at ease from what Courtney was saying about it being a nightmare being at home, that's temporary, and these folks can take care of everything that you have going on from a physiological standpoint.
Mm-hmm. I had a few more. Adam, did you have any questions? I feel like I don't want to.
No, I was just going to say, Courtney, I thought it was interesting. You made the point about, and it's something that, you know, through all of this, through the anxiety and just the, you know, the first 6 to 8 weeks of this pandemic, when it really kind of hit this area, something that I thought was really interesting looking back on it, you know, those school age kiddos, I've got twins, 16-month-old twins at the house. I don't have school age kiddos, but, you know, that Friday, it just got really crazy, that Thursday, Friday, and Whitney specifically. Whitney ISD went on their spring break, and then they just never went back to school. So, you know, that social aspect that those kids didn't have,
Right.
that role, like you mentioned, and that's a good point that I wouldn't have thought of. You know, and of course you deal with stuff like that on a daily basis, so that's some good stuff right there.
Thank you.
I wanted to ask. Oh, go ahead.
Sorry. So I was going to say some of the manifestations of the anxiety or things like, you know, having really difficult times with sleep. I'm seeing that a great deal. You know, you can't turn your brain off. Your mind is racing and you're constantly thinking about the future, like what Courtney was saying. You know, okay, if we get this, then what? You know, do I prepare a end of the world pack and get everything together in the family? You know, or other manifestations include just difficulty with staying on task during work or at school. You know, having your mind bebop around and not really able to complete because you're constantly infiltrated with all of this virus information. We are given to walking around with our phones and checking Facebook all the time,
Mm-hmm.
or getting heavily inundated with news, so that that's anxiety producing, and we forget to live right here in the moment, enjoying a conversation with some other folks, and being present.
Mm-hmm.
Always living in the future, always living in anticipation, whatever, you know, waiting for the next shoe to drop. Okay, now COVID, now what? Are we going to have planes go into the Pentagon? You know, what is our next, what's the next horrific thing that's going to come on?
Mm-hmm.
And so the anxiety that all of this uncertainty, all of this lack of information that is bringing up, it, if anything, seems to be in good families, good relationships anyway, seems to be hopefully getting us to strengthen those relationships that we have together, to live right here, live with, you know, figure out who those most important people are, and really begin to spend time with them, and not scattered among 100,000 quote friends on Facebook, but really beginning to find out what's important with us. So
Yeah, Dr. Pickering, what I like where you're going with this, because I wrote down 2 things for tonight, and it was be present and be intentional. And that's what you're talking about. You're talking about, just being in the moment, not looking in the past or too far in the future. And I tell my patients that all the time, that when you look too far in the past, you're going to be depressed. You're going to beat yourself up about the mistakes that you've made. When you look too far in the future, you are going to be anxious. You can't go too far out. You've got to stay in the moment. And I tell my patients, keep your mind where your body is. And very, very rarely do we do that. As human beings, we very rarely have our minds where our bodies are. So being present is super important. And what you're talking about is just being intentional. And if we could do that with our families and just figuring out our priorities, twice this week, I've talked to just a couple of my friends, and I called about soccer practice and what time it was yesterday. And a friend of mine, I said, am I bothering you? And she said, oh, I'm about to read to, my son or something. And I'm like, that's being intentional. Being intentional is saying, I'm going to spend time with this person, and I'm just going to do that. And I'm not going to pick up my phone. Yes, I can talk to you for a second. What do you need? Setting that phone down, putting it in a different room. Being intentional with the people around you who are your priorities, setting that time aside for them, and keeping your mind right where your body is, staying in the room where you are. That's important.
it's so easy to get distracted just by our lives anyway. In this 21st century, we have so many things pulling from us. And now we've got this hyper information of this virus that could potentially threaten our lives and our friends' lives. And so our minds are having a real difficult time grasping this new normal. And I love that idea of being intentional. I think one of the things that I picked up from this was from another counselor friend who used to say, when things are falling apart and there's anxiety, try and make sure that you pay attention to routines. You are going to find that you're going to have several days in a row when you're not going to get good sleep. Make sure that you get just a real practical thing. Get to bed at the same time, even if you don't feel like it. And more importantly, get up at the same time, even if you don't feel like it. Make sure you're brushing your teeth, whatever those routines, maintain that structure in your relationship. When you're at home and you're doing all these telehealth meetings, it's really difficult to be divided with your child who's coming in and saying, hey, I want a snack. Well, suddenly you break your brain out of the work routine and into home routine. So it turns out that having barriers and good, strong definitions are very good for us as humans. That borders are good things. So trying to maintain that exercise program that you have, whatever those routine things are. You always go out on a Friday night with your spouse on a date. Make sure you do that. Hold to those things. They'll carry you through a lot of this confusing anxiety.
I see. So while the state of the world is kind of forcing us to pull back on the reins, basically what you are both saying is our minds are still used to going 100 miles an hour, but instead of fighting that, we're at home anyway. We spend way more time at home. Focus on what's there at that time, which is really what should be most important to us anyway, which is our families and our loved ones. And that's a great opportunity to reconnect and just ground ourselves with those important to us. That's really good. I wanted to follow up since we're talking about the depression and the anxiety. We've done a great job. I mean, y'all have done wonderful talking about kind of the symptoms and, kind of just some things we could do when we're feeling that. But at what point, for the listeners out there, At what point should they admit to themselves or get to that point where this is at a point where I need to probably talk to somebody? And really, where do you go from there once you feel like you reach that point?
Okay, I think that's a really good question, and I think that's a different answer for different people.
Mm-hmm.
Okay, I think that the best answer is when you aren't feeling like yourself, it's time to talk to somebody.
I see.
When you are, and that means something different for everybody. When you, just like what Dr. Pickering was saying, is like, if you can stick to some of your routines, it's going to be really helpful. And if you can stick to those routines, it's going to give you some kind of normalcy.
Mm-hmm.
But when you are outside of what normal looks like for you, when you are a morning person at heart and you're sleeping till 11 o'clock in the morning, that's not you. And you might want to start thinking about that. Do you see what I'm saying? Like, if you're an early riser, for 4:30, 5 o'clock in the morning, you're popping out of bed, and hey, the last couple of months here, you've been sleeping and it's hard to get out of bed, and you're not taking care of your hygiene like you normally would, and those types of things. You're not that person that you were before. It's time to talk to somebody. Talk to your doctor. And I think that doctor, your primary care physician, is probably your first line to go talk to about what's going on with you, because generally when you have anxiety and you have depression, your sleep patterns are altered in some way.
Mm-hmm.
You have a difference in your motivation and your daily activities. And again, that looks different for everybody. That looks different. What do you think, Dr.?
Well, I will tell you, I will chime in before him. I think that if you have listened to any other podcasts, and I love that Justin's laughing at that, because that plays right into what I'm about to say. I think you would pick up on, I'm a little bit of an alpha male personality. So I'm the last person on the planet that wants to talk about my feelings. And there are people, and I love that Courtney's laughing at that, because, I know that there's some people that listen to this podcast that feel the same way. Like, I don't want to talk about my feelings. Like, I don't have feelings. I don't even know what those are. I just show up and I do my thing. But I am fortunate enough to work alongside these two every single day. And there are times that we are sitting around the break room table and we are eating lunch, and I may say something that I think is completely like work related, and then Courtney picks up on that and she starts asking questions. And it's not the typical, okay, Colt, I need you to come lay on this couch and I'm going to turn down the lights and we're going to talk about, tell me how that made you feel. Like, that's not how it works. They are good at what they do, and they are good at pulling those out of you. And Courtney laughs at those things because I'm the person that's like, hey, how's it going today? Fine. And then that's all she gets. And she's good enough to go like, okay, so I'm going to poke a little bit more and ask you these questions to figure out how you're actually doing. And if you're fine, cool, I'll leave you alone. If not, I'm going to poke a little bit more.
Uh-huh.
So I say that to say that I think almost everybody would benefit from talking to someone. The person who would never admit in a million years that I think it's good to go talk to somebody because I don't want to talk about my feelings because they don't exist.
Uh-huh.
It's probably good for everybody to go talk to somebody because you have something. Whether you want to admit it or not, there is something that would benefit from talking to someone.
He's such a boy. He's such a boy.
Colt has feelings.
Tough of downs. I'll tell
That's
you.
a good point, Colt. Good job.
I was going to mention just a couple of sort of practical things because patients will just come right on out and ask me, so I'm having, and as a physician, we're all taught, pretty much we're all taught, there are these 9 things that we all memorize, and we have this little acrostic that goes on in our head when we're trying to problem solve whether or not somebody is clinically depressed or anxious, and we ask pointed questions about those and see if they measure up or not. And so they include the things you might imagine already that Courtney has already mentioned, several, like the feeling of hopelessness or, that things aren't going to get better. Sleep is always an issue. Interest, are you still having interest in the things that you enjoy doing or don't? What about feelings of overwhelming guilt? What about low energy? And the list goes on. But some of the practical things in your question of, when is it you decide I need to seek help? One of them I look at is, are you beginning to avoid things? Are you, is the anxiety so high that you're starting to make excuses, put it off? Does it take you 3 days to do this one task that normally takes you just a couple of hours, or to get around to do it? I'm reminded of this patient that I had. It was a wonderful lady who very functional, had a great job, worked in a neighboring town of Waco, and did very well, and for some reason began having anxiety. Well, and the anxiety seemed to be around her going to work. So she began to make excuses about going to work, calling in sick. My uncle died, got a flat tire, and it began to be more frequently and more frequently. Pretty soon it was really jeopardizing her job. But that kind of avoidance behavior, when you can measure those kinds of things. So that's one thing I would look at. Another thing is it affecting two things? Is it affecting in some way your work life, your ability to do your routine, normal, your function and your performance at work? And the other is it affecting your relationships? Are you having communication breakdowns or more avoidance in relationships with your spouse or your children or your siblings? So looking at those kinds of more objective things, I think that's when you begin to see that everybody gets down, everybody gets some anxiety, everybody gets some depression, we all have sleep issues. But when it begins to affect those areas of your life, that's when I say, whoa, we need to probably get ahead of this before it really starts taking on. Mm-hmm. Usually they come see me, and then what I do is I go point at Courtney. I said, go talk to her. She'll fix you. So.
Well, and the reason I said talking to your primary care physician would be best is a lot of people there's still that, what's the word I'm looking for? There's still some, why can't I think of the word? Stigma surrounding mental health at times. And they just I think some people just want somebody to say, it's okay. It's okay. Go talk to them. It's all right. It's going to be okay. Sometimes it takes that little nudge. It takes, hey, you're not going in the wrong direction. They're already thinking I need to go talk to somebody. But if their doctor tells them it's okay and that's a great idea, then they have that validation and feedback that that's the right thing to do. And I think some people need that. So that's why I said going to your primary care physician and kind of getting that might be important for some people.
Okay. That's all very good. Thank y'all for sharing that. We are starting to get a little low on time. I wanted to ask, just generally speaking, I mean, we talked about quite a few, kind of precautions and things in regards to anxiety and things like that. And as we all know, the pandemic situation is constantly evolving. So what advice would y'all have, for people that are still concerned about the virus? Are there any precautions or best practices that y'all would just recommend to people if they were to come to your office and, they're just, they're really kind of concerned about the virus. They want to be sure they don't catch it. They might not necessarily be feeling anxiety or depression or anything, but they just want to be sure that, they don't end up like Colt over there, 14 days holed up in the house with 4 kids or anything like that.
I think the first response from an administrative perspective is it's okay to go to the doctor. You mentioned coming into the clinic. I think there's a lot of people that are scared of that.
Mm-hmm.
Well, that's where the virus lives. So I'm not going in there. You got to be out of your mind.
That's where sick people go.
I
You
can
wanna
assure
avoid
you
that, yeah.
that we are, and I can speak for, I think, healthcare as a whole industry across the United States, that, we are taking every precaution that we possibly can to make sure that every single person, including our staff, walks into the building is safe. I think, and from an administrative perspective, one of my biggest concerns is, just like most people, what if the school shuts down? Well, I have 90% of my staff that has school-age kids. So if the school shuts down, I've got to figure out what I'm going to do with my staff. So, of course, from a selfish perspective, I'm going to keep our clinic as safe as possible, because I don't want anybody that comes into our clinic, especially school-age kids, to get it, because I can't afford that from a clinic perspective and a staffing perspective for the school to shut down. So, I think we are taking an overabundance of precaution, which is a good thing, and making sure that we are constantly keeping everybody safe as much as possible.
Mm-hmm.
So the old saws of making sure that you're having social distancing, wearing your mask, not gathering in large groups, making sure that you're washing frequently. All of those things are really very good. Don't touch your eyes, your nose, your lips. They actually work. They really do help. So those are some very practical things that you can do as well. You carry around your alcohol sanitizers with you, and do it.
Okay. Courtney, do you have anything to add to that?
Yeah, I'm just gonna agree with Dr. Pickering. That's what I would say is, like, wear your mask, use your hand sanitizer, wash your hands. I think that's the best thing that you can do. I think those are the only things that we can really do to keep safe. And like Dr. Pickering and I talked earlier today, and he was saying something about controlling what you can control.
Mm-hmm.
And that's what we can do. Those are the things that we can control. We can control washing our hands and wearing our mask in public and keeping a distance from people. And really that's all we can do. And so we have to do those things that are in our control and realize that we got to stay away from the things that we can't. And so that will help. That really will help for all of the things that we've talked about today.
That's great advice. So, like I said, we're running a little short on time. We got about 2.5 minutes. Adam or Colt, did y'all want to add anything or have anything you want to just toss out there?
No, I just want to, on behalf of the Chamber Board of Directors and the Lake Whitney Chamber of Commerce, thank y'all for joining us this evening. I know Justin will wrap it up in a second, but we appreciate y'all's advice and taking time to chat with us today.
Absolutely. Thanks for having us.
Absolutely. Thank y'all for taking time. I know y'all are both very busy people. So we definitely appreciate you just carving time out of your evenings when you could be with your families, sit down and deal with a couple knuckleheads. Colt, I know you got to say something. You got something you want to say.
We only have 2 minutes.
You don't want to get cut off.
I'll echo everybody here. Thanks to you, Justin and Adam, for taking time out of your day, and Dr. Pickering and Courtney. I guess a shameless plug here that of course we're available at Goodall Witcher. Absolutely, if there's anything you need, and I know that there's a variety of healthcare providers through Hill County and Boston County. If we have any listeners from Boston County that you guys can choose from, we're here to help. Like we talked about at the very beginning, our passion is to help you. We don't care what walk of life you're from. We don't care what issues you have. We don't care any of those things. We are here. Our goal and our passion in life is to help you in particular get through whatever it is you have going on. So we would be happy to take you on, as would any other healthcare provider that you may come encounter with.
Awesome. All right. Well, thank y'all again, everybody. Really appreciate it. Appreciate everyone that tunes in and watch and listen to us. If you don't already, be sure to check us out on Facebook. Give us a like. If you're on YouTube, subscribe and give us a like there. Share with your friends. Get the word out. And I'll see you guys and everyone listening in the next video. Y'all take care.